Good evening. I'm Dr. Lavanya, a practicing dentist from Chennai. Today, all of us are aware of the major healthcare crisis that's happening, resulting in a pan-India lockdown. During this lockdown, most of the dental clinics are closed too. What do we do if we have dental pain in such crucial time? Today, in this video, I will suggest some easy home remedies which we can try at home to alleviate this pain. First, we'll see what are the reasons why we get this toothache. First, major reason being cavities or holes in the teeth which have not been treated or filled in a long term. The second reason being loose gums or weakened gums. Third reason being eruption of the wisdom teeth. So now we'll go on to the home remedies. The first and the most easiest home remedy is chewing of a clove, which most of us are aware and it's easily available too. So what do is we take a clove, chew it between our teeth and keep it over the tooth which is hurting. We keep it for about 10 to 15 minutes and spit it out, and maybe repeat after an hour or so. How does the clove help? Clove has something called eugenol in it, which has an anti-inflammatory action, and it has a numbing effect too, because of which the toothache is substantially reduced. And it's the most easily available ingredient which we have. If we have access to clove oil, it is effective too. Second most easiest method is salt water gargling. What is salt water gargling? I'm sure most of our grandparents or parents would have suggested it too. What do we do in salt water gargling? It's a very simple method. We just take a warm glass of warm water, add 1 teaspoon of rock salt into it, dissolve it nicely, gargle and spit it out. How long do we gargle? We gargle for about 30 to 40 seconds. What if I'm not able to gargle? Just keep it in your mouth for 30 to 40 seconds and spit it out. How many times do I do? You can do as many times as possible, at least 4 to 5 times in a day, preferably after each meal. How does salt water gargling help? It helps because of salt, which is a natural antiseptic, and gargling, which tends to loosen the food that is collected between the teeth. The third method being gargling with mouthwash. How does that help? Mouthwash, which is easily available in the supermarkets, you can just take a cupful of it without diluting it, swish it between your teeth and spit it out. You can do this again 3 to 4 times in a day, preferably after each meal. Most of these mouthwashes have chlorhexidine in them, which has an anti-inflammatory and antiseptic effect, which tends to reduce the inflammation around the teeth, thereby reducing the pain. The fourth method by which we can reduce the pain as well as the swelling that is there between in the teeth is by the use of cold compression or ice pack compression. What happens in this is you can just take a few ice cubes, put it in a Ziploc bag or a polythene bag and compress it from outside. You can compress it for 15-20 seconds, take it off, again 15-20 seconds and take it off. You can do this for about 10 to 15 minutes and then take a break and try it again after another 15-20 minutes. How many times can we do it? As many times as we want. How does this ice pack compression help? It helps by reducing the inflammation in that area, and ice tends to cause some numbing effect, because of which pain and swelling is reduced. And most of us have noticed that the toothache comes during the evenings or when we sleep. So why does this happen is because the pulpal fluids get collected by the end of the day, and because of gravitational force it causes pain. So ideal solution would be to lie down at a slanting position, maybe with the help of 2 pillows, because of which the pain would drastically reduce. Another effective method to reduce pain would be brushing. Brushing we do twice daily. Then how does it help to reduce pain? Most of the time the pain occurs because of the food that gets caught into the cavities. Because of brushing, the food is removed from the cavities, thereby the pain reduces. So a very effective method to reduce pain is by brushing after you have the food. You can do it preferably after every meal. Just take a little bit of your toothpaste, apply it over your teeth and brush it with your brush thoroughly so that the food that has got into the cavities is removed completely. It really reduces the pain. Try these home remedies at least more than once for them to be more effective. If these remedies don't work, please contact your dentist at the earliest possible, at least over the phone, to get a more specific and effective medication. A word of caution, please do not self-medicate without your doctor's advice. Hope these remedies will help you reduce the pain until the lockdown is over, after which you can contact your dentist for a more effective, more permanent and definitive treatment. Please share this video with your loved ones who might be going through a similar problem. Thank you.